Hello, my name is Jeon from Korea University Medical Center, South Korea. We are very pleased to present this study at the ICS. I have nothing to disclose in this study. BPH is a highly prevalent disease in aging male patients, and it can negatively affect the quality of life. Korea has one of the most rapidly aging population in the world. According to data from the Health Insurance Review and Assessment Here Agency in 2018, about 7,600,000 patients were diagnosed with BPH in 2010, which increased by approximately 1.2 million in 2017. Currently available surgery for BPH in Korea are TURP, KTP, HOLEP, open prostatectomy, transurethral ablation, and prostatic ligation. Currently, the most commonly performed surgery in Korea are TURP, KTP, and HOLEP. The surgical trend in BPH have been studied in several countries including United States, Canada, and Japan, but there were no other statistical studies available in Korea. So the purpose of this study was to analyze the overall surgical trend related to surgery. From 2010 to 2017, the trends of surgeries for BPH were reviewed according to the procedure code including TURP, HOLEP, or KTP, and this trend also analyzed by age, geographic distribution, and hospital type. Our research were based on sample code big data analysis using the National Health Insurance Database. Figure 1 shows the total number of operations performed in the last 8 years. There were no significant difference in the total number of operations between 2010 and 2017, and TURP remained the most commonly performed operation for transurethral prostate surgery. Total number of conventional TURP remained stable. KTP was the second common operation in 2010 and 2011, but the number of KTP shows a gradual decrease and eventually dropped to 622 in 2017. On the other hand, the number of HOLEP dramatically increased. In 2010, the number of HOLEP was only 278, but the numbers did increase and finally exceed the number of KTP in 2012 with a continuing steady increase in the difference. Although the overall number of operations does not seem to be significantly different, the number of operations per 100,000 patients diagnosed with BPH tend to decrease in all age groups. KTP and TURP tend to decrease in all age groups, but HOLEP increased in age group over 60 years. Since 2010, 70s were the most common age group undergoing surgeries, followed by the age group of 80s. The same trend was observed in the case of HOLEP as well, with the 70s age group being the most common age group, followed by the age group of 60s. However, in the TURP group, the age group of 80s was undergoing more surgery than the age group of 70s since 2015. Most surgery of BPH are performed in large hospitals, which increased from 71% in 2010 to 81% in 2017. According to types of surgeries, about 80% cases of both TURP and HOLEP were performed in Superior General Hospital and General Hospital in 2010 and 2017, respectively. Meanwhile, 47% of KTP was performed in large hospital and 35% was performed in clinics in 2010. However, the proportion of large hospital was increased to 87%, and only 76 cases were performed at the clinics in 2017. In conclusion, In Korea, during the last 8 years, TRP was the most commonly performed BPH procedure, followed by HoLEP and KTP. Since 2011, HoLEP has continued to increase and KTP has continued to decline. The most common age group to receive BPH surgeries is over 70 years old. Additionally, BPH surgeries have been carried out mainly in big cities with large hospitals. Throughout the data of National Health Insurance Service, we could apprehend the present status of BPH-related surgery in Korea. Then we could know about the trend according to several factors, and we think this result will be valuable as academic reference as well. Thank you.